Hello everyone, Dr. Andrew, Dr. Sarah from Functional Wellness Center here in Scottsdale, Arizona. At our office, we specialize in something called chiropractic biophysics. And what that is when you come into our office, we do a consultation examination and x-rays, and we evaluate those x-rays. And if you happen to have scoliosis, we have many different ways we can help you treat that. One thing we use in our office is called Denerols. These are actually specific for scoliosis. There's two different ones. And scoliosis can happen in one area of your spine or it can be in multiple areas of your spine. So that's why we have to analyze the complete structure of your spine. So we do different tractions, different home care for situations like that. And
yeah, different exercises too. Because when you have those curvatures, I mean, it's one of the most difficult ailments to correct in the spine. But even a small correction can make a ton of difference in a patient's life.
And you don't want it to progress, so at least you
exactly.
You don't want that to happen.
Yeah, so the more that curvature is, the more pressure it puts on the discs and the nerves, and then the more problems that can occur due to the damage in the spine and the increase in that curvature. So the quicker that you catch it, the better, at least for us too in correction. So there are two Denerols. These would be ones that you do at home, and sometimes we use them in the office with the traction that we do in the office as well. But you'd use them at home. This is the thoracic one, and so that means that this part
in the mid-back,
of the body, in the mid-back. And then this one is the low back, and so it has a little shelf for the hip. And so because we do CBP, chiropractic biophysics, we are able to prescribe these to our patients. And then this would be the traction that they do at home every day. And then they would come into our office and do traction in the office, and that would look a little different. But it's the same concept, really trying to straighten those curvatures out or reduce them as best that we can. We also give you exercises, very specific exercises for that as well, with adjusting the spine too. So let's show you what that looks like.
Which one do you want to do first?
Dr. Andrew lay down. Let's do the hip one first.
Okay.
So the hip one is going to go about right here, and then his hip is going to come up on that, and then it's going to go down. He's going to come down on this. And this one would be more for the lower back. So if you had a curvature in the lower back, we would use this one, and then you would also use that at home when you come up, because they're not comfortable to be on if you don't need them. There's also the thoracic one, and this one we sometimes start off putting like a towel over because it can be kind of rough on the ribs, but we'd start off really slow. And then we put that in the specific spot that is needed so that we can get better curvature or reduce that curvature in the thoracic spine as well. So you can come on up here. There we go. Yeah. And like we said,
sometimes you got to address multiple areas of the spine because scoliosis can definitely affect all the way up. So there's different areas we have to put straps, and we have to stabilize you in order to get the best correction possible. But like she said, even minor correction scoliosis is huge. It's huge.
Yes.
we do get pretty good results, and
amazing results.
Really. Yeah, and you don't want that to progress, because the more it progresses, the more damage it causes, and the more symptoms that you will have.
Yes, and then also like the earlier that you catch it, or the earlier that we catch it, and that you know that it's happening to your spine, the better correction that we can get. So it's all just dependent on, the degree of the curvature and when we catch it, and when we're able to fix it. Hopefully to a certain extent to your 100%, whatever that 100% is for you. Everybody is different. So that's what we do for scoliosis. If you have any other questions, please visit our website, chiropractorscottsdale.com, or you can give us a call.
Our email address is on our website. You got any questions or concerns, let us know.
Okay, thank you.
All right, thank you.